welcome back to Chronically Fit with Chiara. It is June, and as you may or may not know, June is PTSD Awareness Month. So I couldn't let the month pass without adding another episode of Trauma Talk. If you haven't watched my first Trauma Talk video, you can feel free to check that out now. That video goes into what PTSD is and a little bit about what I've experienced and how I treated it. Today, I want to go further into the symptoms that I have had with PTSD and what treatments have really helped me and what a session using that type of therapy is really like. Because if you haven't been to trauma therapy before, you may not know what to expect because it's a little bit different than regular talk therapy. So to start, I wanted to go over some of the symptoms that I've experienced. And while I am still treating for PTSD, I wouldn't say that I'm cured yet. I am substantially better than I was originally. So I feel very confident that I can share some tips that might really help you if you also suffer from trauma. So I first didn't admit to myself that I had PTSD. I didn't feel like what I experienced was a big enough trauma to consider being, technically traumatic. I learned later on that there's no such thing as a little or big trauma. Trauma is trauma. It's really just how your body responds to an event that takes place. So my first symptoms were mainly a lot of anxiety, paranoia, depression, and then it just really progressed to completely debilitate me. I was no longer functioning at all. I really wasn't. And I don't think that a lot of people in my life knew that. But yeah, the PTSD severely impacted my life, and I just couldn't function as a normal person any longer. So I sought treatment for it, and thank God I did that, because I don't know where I would be today if I wasn't. So in addition to anxiety, paranoia, and depression, I also started experiencing very bad pain and fatigue, digestive issues, dizziness. I also have some physical ailments, and I think that, the PTSD, ever since a traumatic event, it seemed to have triggered that high stress, brought me out of remission of a past illness, and kind of caused a big change in my physical health. But focusing on just PTSD symptoms, in addition to those physical symptoms, I also was experiencing heightened sensitivity, very sensitive to smells, flashing lights, noises, experiencing irritability and rage, experiencing flashbacks, nightmares, insomnia, and intrusive thoughts were my worst symptom. The intrusive thoughts were what really debilitated me. It's hard to function when you don't feel safe in your own brain. If you don't feel safe in your own brain and body, where can you feel safe? So the intrusive thoughts really prevented me from being able to calm myself down and calm my nervous system down. So there's a lot of different symptoms you can experience with PTSD. Some that people aren't familiar with usually are the pain, physical pain. I had horrible shoulder pain. I had really for a year, just absolutely terrible pain in my right shoulder. It is way better now since I've started treating. Just kind of amazing. I didn't realize that pain was because of trauma being stored in my body. A lot of people also experience having muscle twitches. And for me also, one that was so weird was excessive yawning, which now I know that your body yawns when it's releasing trauma and calming your nervous system down. So now I've had less episodes of that excessive yawning where I was literally unable to stop yawning, now that I have started to treat it. So with all those symptoms, I really couldn't enjoy life any longer. It was hard to do anything. I couldn't watch a lot of TV anymore. If anything that used to be I used to watch horror movies, I couldn't watch them. Still can't really anything that got the heart rate up, I was very sensitive to, and still kind of am, still working through that. But yeah, I just didn't realize that heightened sensitivity to a lot of different things could happen with PTSD, and I really never knew how intense the intrusive thoughts could be with PTSD. I've always, I've suffered from anxiety for years and have had intrusive thoughts with anxiety and depression. The intrusive thoughts with PTSD were way different. I mean, it was constant, like every single second of every day, and I just never felt safe ever. So I really do encourage you to seek treatment if you have experienced trauma or you're showing signs of PTSD. A lot of people have experienced trauma in their life and they don't even realize it. So if it's something that you haven't explored and you've been kind of suffering, I really suggest at least looking into it. So now I will share some treatments that actually worked for me. So I want to first start by talking about traditional talk therapy, because that's what a lot of people would think to go to when they're having a mental health issue. And I'm going to say that it is not the right choice for treating PTSD. It can be helpful for some people, it's possible, but it does not access the nervous system in the correct place. It doesn't access the right part of the brain to really be able to help you release trauma. And that is the first thing to understand about PTSD, is the trauma is stored in your body, in the nervous system, and in your brain. So it isn't just a mental illness, like it is, but it also has a physical aspect to it, and you have to address that physical aspect in order to get better. So if you're only in talk therapy, you're never going to really hit that part of your body where the trauma is being stored. So I don't even know if I suggest it. I can't even really say that I suggest it. I mean, any therapy might be better, but talk therapy can actually make PTSD worse, because it brings up the trauma and gets you to that heightened state, but it doesn't access the nervous system to help you release it and come back down. So I can't even say that I recommend it. I really would avoid talk therapy if you're experiencing PTSD. So what would I recommend? So I have done a couple different things, and each were helpful in their own way. I'll save the most helpful one for last, but I feel like the way I did it is the best way to do it. So as I said, I was really, really suffering, couldn't function. So the thought of diving into trauma therapy was overwhelming, because I was not at a place where I could even talk about my trauma. I could not even bring it up, or the word associated with it, without being sent to a full panic attack and the rest of my day being ruined. So I started with somatic experiencing. And if you are suffering severely from PTSD, I think somatic experiencing is the best place to start, because it is not talk oriented. The amount of talking is very minimal, and it's really focused on your body and connecting your mind and body, becoming aware of how your body is reacting and storing trauma, and being able to start releasing those things. So it helps you get an awareness. For me, it was also extremely empowering. I didn't realize how much power PTSD had taken from me until I started going to these somatic experiencing sessions and walking away feeling incredible, feeling in charge, feeling like I had the ability to overcome this. So somatic experiencing is a very gentle practice. It was started by Dr. Peter Levine, and there is a lot of information out there about it. You should use a certified practitioner for it. And basically, for a session, you bring up the trauma. So it's about getting into that heightened state so you can feel where the trauma is in your body, and then it's immediately calming it down. So it's really interesting. It's not about staying like where traditional therapy, you are kind of in that heightened state talking about it for the whole session. This is you bring it up and then boom, bring it back down. Bring it up, bring it back down. So it's really gentle. It's so gentle, which is why I think it's a perfect way to start trauma therapy. It really is, because you don't have to feel that pressure, like you need to talk about this. And sorry. So basically, I would just kind of show you an example would be like, I'm going to start calming my body down. I'm going to just take in what's around me, kind of look. And it's something that you will naturally do. And it's something that if you study nature, animals, you'll see them kind of respond similar ways. And it's really interesting seeing how animals respond to trauma and comparing it to how humans respond, because the animals kind of have it set. They immediately, after the trauma, they know how to release it. As humans, we tend to not give ourselves the chance to release it. We just ignore it. So we try to like be like tough and be like, oh, we're fine, we can go on with our day. And that's what I did. And that's part of why I suffered so much, is I immediately I just continued on with my day. I continued on with my job. And I never gave myself a chance to actually acknowledge what had happened. So that's step one. If you're experiencing trauma, give yourself a chance to actually just release and acknowledge what happened. Don't keep it in. So with this I'm experiencing, I would share a little bit with the practitioner, just whatever I felt comfortable talking about. And then I would focus in on my body and identify where in my body I was experiencing a sensation and kind of give it the attention that it was looking for. And it helped release. And then, and then I would just calm it back down. When it started to feel too much, I couldn't hold on to the thought anymore, I would let it go. I would start observing the room. I would play with some therapy putty, stress ball, and just kind of become aware of my surroundings and just grounded in the present. I had mentioned the shoulder pain that I had. Well, that was associated with one event. So I have a complex PTSD and I have standard PTSD, and part of the complex PTSD, one of the events involved me being unable to physically have autonomy over my body, and I wanted to push someone away, but I couldn't. And that shoulder pain, it was crazy. The practitioner, she asked me, because I had been complaining of it, she was like, well, what if I just kind of guide this? What if you just try to push me away? And I did. And so when I really went into it and I pushed away as hard as I could, imagining, visualizing that it was in the scenario that I was in, my pain went away. It released. It and I won't say that it went away for good. There were a couple times it came back, and I would have to go through that again, go through the process again until I really fully released that from my body. But it was amazing. I didn't know that pain that had been causing me so much distress for months was because there was trauma stored in there. And I had to get it out, because in that moment, my body wanted to do something, and it was trying to do something, and it couldn't. So that's really important to be aware of, and that's what somatic experiencing does. It helps you become aware of what your body wanted to do, how your body wants to respond to trauma, and it gives your body the chance to do what it had wanted to do. So I really, really, really recommend working with a somatic experiencing practitioner and giving that a try, especially if you experience things like muscle twitches or pain or any sort of physical symptoms with your trauma and PTSD. So that was part one. And with that somatic experiencing practitioner, I also did a little bit of brain spotting, which is also really interesting. So brain spotting uses your eye location, so where your eyes are positioned, to access the part of your brain that trauma is stored. And it's really interesting. I recommend reading up on it. It worked pretty well for me too. We did this with my last couple sessions with the trauma therapy. So I did several sessions of somatic experiencing, and it depends on the person how many sessions you'll need. It's usually at least 3, but for me, I did about 9, maybe 6 to 9, something like that. So it just depends on you. So with the brain spotting, we had done this again towards the end, so after several somatic experiencing sessions, and this really was just focusing on where she was drawing my eye to with her finger. Some people use laser, and noticing where my eyes were located when I started to feel a physical sensation when thinking about the traumatic event. And then just pausing there, keeping my eyes in that position, and working through releasing the trauma in a similar way to somatic experiencing. So it was just another way to access the nervous system, access the brain, and go a little deeper with releasing the trauma and paying attention to that mind-body connection. So that is also another great option that is kind of similar. They're quite similar. And then the last one I wanted to talk about, last form of treatment, is EMDR, eye movement desensitization reprocessing. I believe, sorry, that's off the top of my head. I try to keep it in there, but I think I got it right. If I got it wrong, I'll correct it in the description box. But yes, EMDR is incredible. You do need to work with a licensed therapist for this. I believe that only licensed mental health professionals can be certified in EMDR, but it is a really amazing practice. So this is what I do now. I've been treating with EMDR for a year. I plan to continue to do it, not because I necessarily need it like I did back then, but because I find it so incredibly helpful, and helpful not just for these traumas, but for even just like past things in my childhood and teenage years, that just like little memories that are kind of stuck and kind of like fester away that you just don't like. It really helps process them and get them out. It's been really enlightening. It's an enlightening process, finding out things from your childhood that you wouldn't even think like matter or a big deal at all, that when you take on that child's perspective, you realize actually had a deep effect on you. So that's something that I feel like every single person, whether they have PTSD or not, I feel like they could benefit from EMDR in some way, because we all have things that happened in our life that we weren't happy about or made us uncomfortable or upset. So what EMDR is like. EMDR is different than the other two treatments that I just talked about. So that is why I have saved it for last. And I will walk you through now what a session is like. So with EMDR, there is a set protocol that the practitioner follows. And it is a list of essentially like questions. It asks the patient to bring up where's part of the memory was and what they wished they could believe about themselves in that moment instead, and kind of rating how disturbing that memory feels and rating how true the belief that they want to believe feels. And so it kind of goes through not only desensitizing you to the memory, but also reprocessing it in a more positive way to help you go through similar experiences in the future, which is what makes it a really great tool. So it doesn't change your memory, but it just changes how you think about it. And that is really quite profound and so helpful, not only for releasing the trauma and moving past it, but for carrying it on in the future, because there's going to be more bad things that happen. It's just kind of how life is. So it helps you to be able to deal with those in the future. So with those protocols, they have the questions, and they'll ask them a couple times throughout the session, the same questions in the same order. And there's bilateral stimulation involved. So for me, we use sensors because I have light sensitivity. So you can also use a light bar. So a lot of practitioners might use a light bar where a light goes back and forth and the patient follows it with their eyes. For me, I hold two sensors and they vibrate alternating between hands. And that sort of bilateral stimulation helps access the nervous system, which is the goal here. You're always trying to access the nervous system during trauma therapy to be able to release the stored trauma from your body. So what will happen, the practitioner will ask those questions, I'll answer, and then we'll do a round of me bringing up the memory, the part that I need to focus on, and then holding the sensors in my hands. They go back and forth, and just being aware of what sensations I'm feeling in my body and what memories or thoughts come into my head. And this is where it gets interesting, because I have had some things that seem totally unrelated come up, and it's just so surprising, the things that you find out about yourself and the things that are connected that you would never have consciously made the connection to. So you really can learn a lot about yourself and how you think and how you process things. And then after a round of the sensors, then I'll share, what came up, what sensations I'm feeling in my body. Then we'll focus on that, do the sensors again, and then kind of repeat, go through the questions, and the process just kind of repeats for the session. So it really depends on the memory and the person for how many sessions you need to sort of clear it from your body. Some were very quick for me. I only needed maybe 2 or 3 to clear the event. Others are more complex and long, so I need multiple, several sessions in order to clear it. So that has been the most helpful for me is EMDR. I really recommend it to everyone. It's so amazing. And there's so many people who have felt the same way. They just couldn't believe that it was this effective. It is so effective at treating. Now, I'm still glad that I did somatic experiencing first, because like I said, I couldn't talk about my trauma. It was too debilitating for me, the PTSD. So I couldn't have gone in and done EMDR and been successful at it. I wouldn't have been able to follow through with it because I just wasn't able to talk yet. So I think the order that I did it in, doing somatic experiencing, doing brain spotting, and doing EMDR in that order was really beneficial for me. You know yourself, do what works for you, what therapy kind of you're drawn to. That should be a good place to start. And then just like me, after, you start to feel like you have received the full benefit from that therapy, you can always move on to a different type if you still feel you need more. And that's what I did. And it worked out really well. I am so much better now. I mean, even, my husband can see it too, and I feel like that's great. It's really reassuring that, this outside person can even see the difference in me. I don't have those intrusive thoughts anymore. They are so rare. They went from being pretty much every second of every day, being in a constant state of fear and panic, to now having huge breaks from that and being much more happy, happier, calmer, more at peace, feeling more capable. I'm just so grateful. I'm so grateful for EMDR. It changed my life. It gave me my life back. And that's part of what I want to share is with PTSD, I felt like I lost myself. I really did not recognize the person that I was at all anymore. And by treating for trauma, I have been able to start to get that person back, and it feels incredible. So if you've experienced something similar and you're suffering and you just feel stuck and you haven't tried these treatments yet, I really suggest looking into it and working with a certified practitioner. It's so helpful. I can't express enough how helpful it was. It's just so helpful. It's been the most helpful thing that I have had in my health journey. So I really just felt like I had to share this for PTSD Awareness Month. If it can help just one person, then that is amazing, because I know how hard PTSD is to handle. I know how debilitating it can be. I know how it can pretty much ruin your life. It makes it hard to work. It makes it hard to be social. It makes it hard to have relationships. It makes it hard to do anything. And there is hope. You're not stuck like this. It can get better. And the fact that, there is that physical aspect to it. It's not just mental. It is in your nervous system too. If you can just access it in your nervous system and release it, you can get better. There is hope. You're not stuck. So please go do your research, find a practitioner, reach out to me if you have any questions at all. I'm so happy to talk about PTSD and trauma therapy. I am such a huge advocate for PTSD awareness and just kind of helping educate others, because so many people don't really understand PTSD or even know that they might have it. I didn't even know that I had it for a long time because there just isn't enough awareness about it. So if you follow me on Instagram at ChronicallyFitwithchiara, you can find that in the description box too. you can absolutely reach out to me with any questions that you have. All right, I hope that you found this helpful. Please like and subscribe and comment with your thoughts or any questions as well. All right. Thank you. See you next time.